In today's edition of Surviving COVID-19, President Akosua Ayisi in update number 15 indicated the Ministry of Education has been holding stakeholders, has been meeting, engaging all relevant stakeholders on the reopening of the country's pre-tertiary schools to share and promise to share their decisions in due course. Now, most of the private schools have since taken a cue, and I've been engaging parents on how the reopening is going to happen. Now, this is in light of the fact that we're having a pandemic, and I must say some very interesting ideas have come up, and so we'll be sharing those ideas with you this morning. What we want to do is hear some of these ideas with the objective of learning from each other while also refining these ideas. This was why I was inviting people to share with me on Facebook, schools that are doing some excellent work as far as keeping their students COVID-19 safe. Because it's a health issue though, and because we reopened first for the final years to go write their exams, I thought it would be great to have the Ghana Health Service share with us all of some of the lessons learned during the partial reopening. So thankfully, Dr. Franklin Asiedu-Bekoe, Head Disease Surveillance at the Ghana Health Service, is joining us for that purpose. And he assured me he will bring along some excellent representatives as well to enrich the conversation. Thank you very much, Dr. Franklin Asiedu-Bekoe. My other panelists for this morning are Lydia Safo-Ano, the director of the McCarthy Hill School, and Paul Bakpe, headmaster of St. Paul's SHS, and he's popularly referred to as Uncle Paul. Thank you very much, Uncle Paul, and Auntie Lydia, I should say, for joining us for this conversation. Also joining us is the principal of Tema International School, Dr. Ken Daval. Thank you very much, Dr. Daval. Now, this conversation is very important for parents who are concerned about the safety of their children. So call all the parents that you know to come join the conversation and post your comments, questions, and contributions here. Israel Lai, and I must say this program is supported by the Star Ghana Foundation and their funding partners, UK8 and the NIDA, and then the EU. So I'd want us to go straight to Dr. Franklin Asiedu-Bekoe. Thank you very much once again, Dr. Franklin Asiedu-Bekoe. And I'll let you shortly introduce to us Dr. Akosua Ayisi, who's also going to be part of the conversation. But if I know this wasn't part of the conversation, but I want you, if you could, briefly tell us about these reports that are going round that there's going to be a PCR test at the airport when it is eventually opened. I had a conversation with you and you indicated that it isn't a PCR test. So I just want you to just briefly clarify that. And then it can give us the context of the Ghana situation as we speak.
Okay, thank you very much. Let me say that, and good morning to your viewers and other panelists. For COVID, there are three main types of tests that are being done. So the common one is the PCR, which currently we are doing across the country. So we have about 15 sites in country that we are doing PCR. Then we have the antibody test. Antibody test currently now is not being done in Ghana. There has been a lot of evaluations done by FDA, but currently we are not doing antibody tests. Then there's this other test, which is called the antigen test. So what is happening is that in doing the test for COVID, you either look for the genetic material of the virus, or you look for the proteins on the virus, or you look for the immune response. So the immune response is the antibody test. And then the antigen test is whereby you're looking for the proteins on the virus. And then when you look for the genetic material, use the PCR, which is currently being done. For Ghana, we are saying that if we are going to reopen, we are going to require two kind of tests. One is you enter the country with a PCR test, which will be negative. And then when you get to the country, you do an antigen test. So inside the country, what will be done at the airport, it is not a PCR test, it's actually an antigen test. And then you are going to get the results within about 20 minutes. But let me say that I have on the line Dr. Ayisi and hopefully Dr. Charity Sarpong. So that is the introductory remarks that I will say. And the other issue was, I've forgotten, what was it? What was the issue? I think you said two things, I've forgotten one.
No, so it's just about the PCR. Well, the report was that there was a PCR test that was going out. And I'd also want you to tell us give us a context of the Ghana situation right now as we speak, as far as the COVID-19 response is concerned.
Yes, let me quote my DG by saying that we are in an uneasy calm. If you look at the data, clearly there's been a good decline since for the past like 4 weeks. You can see that there's a big decline. Today we are getting very close to the lower limit of 1,000 active cases, and so you see that there's a big improvement in our outcomes, and it's being reflected in almost all the regions. But one thing which we are also concerned about is the low usage of face mask, and I think that it's a challenge for us, because once people see the data going down, they have in their mind that the disease is gone. So they are struggling to say that if the disease is gone, why are we wearing a face mask? And that to us is a challenge which I think going forward, we all as a country must try to address. That the disease is not gone yet. We have very low figures, but we need to be sure that we are sticking to the safety protocols. And hopefully, when it's sustained, they will get the figures that we hope to get.
All right. Thank you very much, Dr. Franklin Asiedu-Bekoe. So I'd want to go to Dr. Akosua Ayisi, who has joined the conversation. So thank you very much once again, Dr. Akosua Ayisi. I would want us to start with the question, is it necessary to demand strict enforcement to the COVID-19 safety protocols among the youthful student population, especially, or considering they are not seen as so high risk?
Thank you very much, Ishmael. I hope you can hear me. Yes. So for us in Ghana, yes, the youthful population generally are known not to be high risk, but then they also form a bed that can facilitate transmission. Just imagine that every home has a child or a youth. Now, given the fact that the numbers are coming down, should there be an outbreak amongst the school children, amongst these youthful population, they are going to go back home, get in contact with their parents and other family members who may be at high risk. And since we know that the infection is transmitted from person to person, then another cycle of transmission or outbreak can commence, and then we'll now see higher numbers coming up again. So they form a bed that if we don't put stringent measures to control infection amongst, especially asymptomatic spread, they would form a channel of spread that would send infections to their various homes and start another wave. The other aspect is that fine, they may be low risk, but then there are some other children that are living with comorbidities that we know. Their children are chronically ill, they have sickle cell, they have diabetes, they have all sorts of other infections. So then majority may not be high risk, but a few of them may be at risk of severe disease. So there's the need that we ensure we control infections amongst them.
All right, now what are some of the observations or incidents or challenges that came up during the reopening of the schools for the final year students?
So ahead of the reopening, a lot of good and positive measures were put in place. There was a joint task force between education and health, whereby various modalities were put in place, the implementation of hand washing systems, emphasizing appropriate spacing in class with at least a maximum of 25 children in a class, given the spacing. We had a view, we looked at the dormitories and made sure there was adequate space, and schools were zoned to health facilities and had established isolation centers and sick bays that were equipped to manage and identify suspected cases and to be able to isolate them appropriately and be linked to the main case management system. So a lot was done. However, there were a few gaps, and the first key thing I'll talk about was the engagement of the community, and then appropriate communication to parents in terms of what to do when cases come up. We all were evident of what happened in Accra Girls, where parents had to storm behind school gates and other things. It's all because parents have a genuine fear and concern for their kids, especially when they weren't allowed to visit them or know what was happening to them. So maybe we could have, a lot of engagement was done through the PTAs, but then information flow could have been better to reduce the unnecessary tensions and fears and worries of the parents. It was legitimate. So then going forward this time, I'm sure that the community engagement, the emphasizing key approaches and steps to do when a case becomes positive is very important for us to do this time. Parents should have a clear understanding on what to do should their child become suspected, should their child become a confirmed case, the terms of isolation, where the kids will be sent to be managed. All those things should be clearly spelled out. Parents should have a clear understanding, and the school should also, information flow between the school and the parents should be top-notch in order to reduce both the perceived fears and real fears of the parents during these times.
Well, now, a number of the things you have said right now just goes to show or tell us that you certainly have learned some lessons, or you have wanted to do things, or you want to do things better. So if you could just take us through some of the lessons that you have picked up broadly with results or following the reopening of the schools for the final year students.
Okay, one of the key lessons, first of all, which I've emphasized already, is the engagement with the parents and the use of the various PTA platforms, the PTA WhatsApp groups, to communicate daily. So the same way the president gives updates to the country, it would be vital that school management constantly updates the parents on what is happening in terms of COVID care within the schools. So daily prompts or weekly prompts, scheduled prompts, would help relax the parents and also ensure that information flow is adequate. Should there be an outbreak, usually we deal with the direct parents of the kids, but then it's also important that the other parents, we may not deal with specifics in terms of names, but the other parents have to know early what is happening and then be able to work with the school to cooperate to get things done. The other challenge is that we realized that though social distancing was well enforced in the classrooms, outside the classrooms, that was a challenge. Kids would naturally want to come together.
Right, it appears we have a challenge with the connection. Okay, Dr. Ayisi.
Chat to just about a few things that are happening. Monitoring, hear me?
Yeah, we can hear you now. So if you could just repeat the point you were making.
Yes, so I was talking about, we realized that in as much as parents, the kids, social distancing is enforced in the classroom, outside the classroom, that was a bit of a challenge, especially during dining times or meal times, the kids want to come together. So then if you, in some schools, we adapted the staggered feeding times, whereby the different classes go for lunch or go for break at different intervals, so that you don't have all the kids coming out at the same time. Then some schools adopted the packed meal system, where meals were sent to the class so that even during meal times, the children observe social distancing. So staggering of meal times and then staggering the start and close of school session may help Maybe class 1 can start earlier at 8, another class comes in at 9. So the shift system and staggering system may also help reduce the numbers at a point in time within the school compound to make social distancing much more effective. These are a few of the things. And then continuous monitoring and supervision. Teachers, headmasters, the education service, health workers were running monitoring systems daily within the schools. That is very key. And compliance to wearing of the face masks, especially for older children. These are things that we need to look at, because without supervision, the kids will pull off the masks. But then with enhanced supervision, they are motivated to wear it. So continuous engagement on the kids, of the children, on the preventive messages and the activities that they need to do to reduce their risk, such as hand washing, wearing of the face mask, is essential to help us be able to have a smooth transition into the school year. Thank you very much.
All right, so a lot of the things that you said now, I would want to believe that will apply to the public schools, but is there the same kind of engagement with the private schools? We have a number of them represented here today.
Yes, so exactly. All the private schools fall within the district health system. And the district health directorate within any area has a mandate over both private and public schools. And I have to say that one of the schools in my district is represented in this meeting. That is one of my headmistresses are here for McCarthy Hill School. So we collaborate a lot. And the same supervision that is extended to the public schools is extended to the private schools as well. So whatever implementation we do, we will be doing for the public. Thank you.
All right, now thank you. We've also been joined by your boss, I believe, Dr. Charity Sarpong. Dr. Charity Sarpong, I don't know if you'd want to add to what Dr. Akosua Ayisi has already said regarding the lessons that have been learned. And, you know, it's a knowledge sharing platform, as I indicated. So clearly, if you would have anything to add to it, we would appreciate that. Dr. Charity Sarpong. So if you could, let us see your video, or turn on your video, and then we can hear from you as well. Otherwise,
good morning, Israel.
Good morning.
And good morning to all the participants. I will turn on the video very soon. Just a second, I'm coming out from where I am. But just to say that I think Dr. Ayisi has said it all. We need to ensure that, one, the first thing we all have to agree is that we cannot let the children stay at home forever, because we don't know how long COVID-19 is going to last. It could last for 1 year, 2 years, months, and our children need to go to school. But how do we prepare for them? Like he said, one, we all have to appreciate the various protocols that have been put in place and ensure that we supervise and make them adhere to the protocols. Sometimes I think that it's so difficult for especially the children, if they don't understand why they are doing certain things, they don't want to do it willingly. But, you know, most of the protocols are things that we should let people have a good understanding as to why they are doing. Why do I have to wear a mask when I'm in public gatherings or places where I cannot really observe that social distancing that I have to? So once we make them understand, why should I wash my hands in between lessons and even lessons when I think I've touched my face mask and other things? Why should I use a hand sanitizer? Why should I do it? So it should form part of the education. And I wish the media will come on board by giving us, you know, airtime to even before the school starts. There should be lots of advertisement. There should be lots of engagement on, you know, social media and other things to let people know that this is the new norm. It has to be embraced. It has to be accepted. And then together we will see things move forward. Thank you.
All right. Thank you very much, Dr. Sarpong. So I have the representatives of the schools here. I have McCarthy Hill represented. We have St. Paul's SHS represented, and we also have Tema International School represented. I want to go to Tema International School to start with, and to Dr. So tell us, what are some of the things they have put in place? I mean, there are a whole lot of ideas that I got to know of trying to put this program together. So I want to start with you. What are some of the things that you have put in place to ensure that when the kids return to school, they're going to feel safe enough?
Yes, certainly, Ian, and thank you. At this stage, we've already started the new academic year. Obviously, schools are closed, so we've commenced online. And we're expecting, whenever schools do reopen, that we will be operating we've allowed for three models. One of which is what we all anxiously hope for, is all students returning to campus. But for that to happen, you know, we certainly need to make sure everything's in place. I've got no qualms with the protocols that have been announced, and we'll follow as a matter of course. We're temperature checking everyone who comes in on a daily basis at this stage, and that's just staff or visitors. When students come in on the main campus, which is boarding, we expect probably having only 50% of the students being able to come onto campus because of the strict protocol and social distancing within each of the dormitories and that. We're going to ensure the right distance. There is sanitizer and washing stations throughout the school. Face masks are required. So we don't have any problem with that. And our experience just prior to the closure of schools was that students were observing those protocols. Despite some of the poor examples out in the wider community, our students and parents are fairly conscious. So, you know, we've probably got 5 groups of thought amongst our parents. The first one is, you know, as an international school, we've got international students in other countries, so that with border closures, quarantine issues, if and when they arrive, and exorbitant airfares, place additional restrictions on these particular students. Some parents will not send their students back to school until a vaccine is available. And, you know, that could possibly be after the current new academic year ends. We've got some parents will not send their son or daughter to school until the community rate of cases has been greatly reduced, so that they have the confidence in their son and daughter returning safely to school. We've also got parents who want reassurance that our school procedures will ensure the health and safety of their son and daughter. And then we've got parents who are satisfied that their son and daughter will be safe to return to school when schools are allowed open. So that's a broad perspective, and the models that we're prepared for is that we do expect some students to be online for the entire academic year. We hope not, but every student is very important to us. Everyone is special, and we'll cater for their needs in these particular times.
All right. I'd want to go to Lydia. So Lydia, I would want to put the same question to you. What are some of the protocols you're looking at putting in place to ensure that when the kids come to school, they'll feel safe enough?
Thank you, Israel, for the opportunity, and good morning to you all. First of all, we have looked at this in terms of 3 main areas. The protocols that have been spelled out in terms of the facilities, the hand washing, social distancing, and all that. We have made sure that all those things are in place. But in addition to that, we are looking at our children coming back, the learning itself. We have already notified or told, giving the teachers a heads up that because of the abrupt, truncation of the academic year, most of the children, if I may use the term, they are half-baked, moving into a new academic year. Most of them were not able to, I know a lot of schools put in place some virtual learning platforms and opportunities, but I don't think every child was able to take advantage of that. So we are preparing for the lapses in the learning process itself. In addition to that, we are looking at the children who didn't even participate at all. There were some who did not participate at all. So the teachers have been told that you are having children move into your classes who are half-baked. They are not ready, they were not fully prepared. So the teachers know the kind of children who will be moving into the class. So adequate provision is made for that. For those of us who have younger kids, the early childhood, preschool children, most of the learning in those places, not actual learning, it's more pastoral care. These children deal with adults on the basis of trust. And for about 6 months, the constant adult, I'm saying this because at least in my school, there are some of these kids who are dropped off as early as 6 a.m. and picked at 6 p.m. So for their days, Monday to Friday, the constant adults in their lives have been the carers, the teachers, and then all of a sudden, they wake up one morning, these people are no longer there, they've had to deal with parents, the various challenges. So the kids have been through a lot of emotional trauma. And we are looking at ways in which we can build that trust again. So providing the teachers with the necessary tools so that that area, most people are focusing on the facilities, the hand washing and all that, but the emotional trauma that these kids have suffered, being at home, some of them have been exposed to various abuses, they are home with older kids or the carers in the homes and all that. So we are looking at that angle as well. And then with our teachers, learning will no longer be the same. I mean, I don't think school will be school as we have known it. So equipping our teachers with the necessary skills so that going forward, as we term it, the new normal, which will become our normal, our teachers are ready and poised to take up the challenge. So basically, these are the 3 main areas we are focusing on in terms of preparation for reopening.
All right, so how are you managing the students as well? Are you allowing everybody else to come into the school? Do you have enough facilities to social distance and allow that to happen?
Unfortunately not. We have relatively small class sizes, 20 maximum, but even with that, with the social distancing, when we did the test run, let me put it that way, we actually spaced the decks, we use mono decks and all that, and we can comfortably take about 13. So that means we may have to be splitting our classes. We have run a number of surveys, and the indication is that 62% of parents are prepared and willing to send their children back to school if the government gives us the nod to reopen schools. So clearly the numbers, we don't expect 100% on-campus attendance. So we are looking at a blended system where some of the learning will happen virtual and some physical for the children to come on campus.
All right, so it's pretty similar to the situation that Tema International School is talking about. So they'll have, depending on what you find suitable, they're going to put in place those arrangements for you. I'd want to come to you, Uncle Paul, at this point. Uncle Paul is a headmaster of St. Paul's SHS. So I'm putting to you the same question I'm putting to the rest of your colleagues. What are some of the interventions you have put in place to ensure that the students will feel safe when they come to school?
Thank you. Good morning, Isalai.
Good morning.
And thank you for all of. Okay, that's okay. Yeah, with experience from the just reopening that we have for the Form 2 and Form 3 students, a few measures were put in place to, as a matter of fact, keep safe the students and the environment. I met a team, basically from the senior house staff, and then we together discussed as to how best we could handle the students when they come. And so from there, we strategized few things as to how many of the people to be taken in the dormitories. And then after we got all those things, we have written their names and posted on each door for them. And so when they come, the day that they reopened, we had a COVID team in place and we met them at the gate. And so what we did was everyone had the temperature taken. And then we had a record for that. After that, you are taken to your dormitory to be sent to where they put on a face mask, and we sent each of them according to the name that we have allocated in the various dormitories. Now, apart from that, I met the staff and we discussed how to handle these students, both the teaching and non-teaching staff. Then after that, we met with all the students as well in turns. And we discussed with them that we are no more in the normal times, and for that matter, to operate with us. And by so doing, we put everyone to be assisted, nose masks to be put on in the dormitory, classroom, elsewhere. Then, one innovation that we did was to recycle our siren. And in our siren, we put all the COVID-19 protocols issues, and so every morning when the siren blares, the siren will repeat all the protocols that are in place. And that helps the students. Hearing those protocols repeated, they are conscious of what to do. Apart from that, either of the students, the COVID team as a coordinated of the temperature. Now, what we are designing now is that when school will open, we are going to put the same measures in place and take all the students through the necessary protocols as well. Now, during the exam period, that is where we had a bit of challenge, but we managed in such a way that all students will have to wash and sanitize their hands. They struggle, but we also struggle with them. By the end of it, we succeeded. They bow down to what we dictate to them. And so strict adherence to protocol will be enforced when they come. Classroom allocations for 25 students per class, as we did for these people, will still be adhered to. All the calls by students are channeled through the senior house master and the senior house mistress. So no teacher is supposed to call any student. No teacher is supposed to call the parents for any student. But if a parent has a problem and has something to be communicated to the parents, the senior housemaster and mistress will do that for them. Then, apart from that, what we also did was that regular checking of temperature in the dorms and reporting the appropriate temperature to the various health facilities as we have been attached to. And unfortunately, we do not have an isolation center, but we have been attached to the community. One of the things that we did was that we asked all the students if there is any health problem, they should channel it to the committee team and the senior housemaster. And so nobody calls anybody to tell the parents or whoever it is that your ward is sick, come and seek him or her. No. We have a coordinated and a central point where the students report their health issues to. And once you report your health issue to the appropriate quarters, we attend to you immediately. Hello?
All right. Uncle Paul, thanks. And you've given us some great insights, especially because your situation is peculiar. You have a boarding facility. And I'm curious, how are you going to manage having the extra students come on? Do you have enough dormitories so that you can accommodate everybody else? And do you have enough classrooms if you decide to limit the number of people who go into each classroom, for instance?
If the first and the second years are to come on board, we might not have the facility because the two badges, we're going to have about 1,165. The just ended one that we had was 763. And even that, in the classroom, we spilled over to the nearest primary school over there. And so if the 2-year group comes, we might not have the facility. And I am of the view that if one batch comes at a time and the other batch comes, I mean, that will be okay for us. Yes.
Okay.
On the dormitory also, unfortunately, I do not have enough dormitory facility. It will be a problem for me if the two badges are actually brought on board. I think that is the issue now.
Okay, so clearly you have some challenges, but fortunately, there probably may be enough time for you to see how that could be figured out. And your internet connection, I can realize, has improved significantly, but I'd wish that you could stabilize your camera so that when we next come to you, we can get a good shot of you. I'd want to come to you, Dr. Duval. Now, you've indicated some of the concerns that some of the parents have had, and I want to know, how have you managed to convince some of these parents? Some of them you indicating they don't intend to bring their kids in at all, but have you been able to convince others, those who probably didn't want to have their kids coming? Have you been able to convince some of them that, well, you could bring your kids in, we're doing everything to make sure they're safe?
I don't believe it's parents must be convinced. It's their decision. Let me be very clear that I respect each and everyone's perspective on COVID-19. I can appreciate those parents who want to wait for a vaccine. I appreciate those parents who have international students in Australia or America in terms of wanting to wait and not having to, for example, sell the house to get an airline ticket to send their kids back to Ghana and then spend 2 weeks in a hotel. There are different issues there that as a parent I wouldn't be happy with. So that, you know, and once again, in terms of making sure that the community, outside community risk is much lower than what it is absolutely critical. I'm confident, and I was confident at the time that schools closed, that our boarding school environment was safe. I believe it was safer inside the school than it was sending students home. I'm still remain of that view. But in regards to that, we respect everyone's perspective, and it's up to Tema International School to provide the learning that suits each situation and to do it well.
So Lydia, I would also want to ask you, have you been able to fully convince the parents that if their kids come to school, they will be fine?
Israel, I think over the years, we've been able to build a certain level of trust, so the parents trust will do the right thing. But some of the concerns that parents have expressed, it's not really about the school, because they know as a school will do everything right. There are some complaints or concerns I have heard is, yes, we allow our children to come to school, you are enforcing all the protocols, but if these children return to their individual homes, how sure are we that in those homes, they are enforcing and adhering to these protocols? A lot of people have people living in their homes who go out to work. Some are going to the market. People are not wearing their face masks. So you still, in as much as around in the school or on our campus, they are safe. The daily, going and coming, how can we ensure that nobody would contract the virus and then come and infect others? So these are genuine concerns parents have expressed. They know with our track record, they know we'll do the right thing. But the concern is what happens in the individual homes.
All right. And for all of you, the school heads, we have Dr. Charity Sarpong and Dr. Akosua Ayisi, as well as Dr. Frankly Asiedu-Bekoe online. So if there are any questions you also have for them, please just raise your hand and I'll give you an opportunity to ask them those questions, because yes, they're here for you. They have put some things in place. You have put some things in place. You probably have some questions that you want to ask about how things should be done, and I'm sure they will be available to answer your questions. But I want to come to you, Dr. Ayisi. You've heard what the school heads have said. Are there any issues of concern that you would want to speak to? For instance, we're looking at the case of St. Paul's SHS, where the Uncle Paul is saying if they're going to have all the students come at once, it's going to be a challenge with space. Would you want to have, do you have any ideas to share with them? Otherwise, Dr. Frankly Asiedu-Bekoe, if you'd also want to come in.
So thank you very much, Israel. I think that, so for such situations like this, what other countries have done is given the opportunity for the educational and health sectors to look at case-based scenarios. So it can't be a straitjacket, one system fits all for every school. I'm sure those developing the guidelines on reopening will look at the various options, because it won't be just for this school. We have regular schools that have a class size of 70 kids in one class. So definitely they would have to look at some arrangements. He's talked about having a shift system where a year group can come in and another year group can come. All around the world, people have implemented different aspects of it. They are doing shift system, they are staggering the hours, so people come in different hours. So then for the various schools, they would have to look at their context, they would have to look at their infrastructure, they would have to look at their setting, and then modify their systems to fit and suit the setting. So just as Dr. Deval said, they would run different systems where some may have face-to-face contact, some may have online school. For the other schools, people may have to run a shift to be able to allow for social distancing. Then he also said that in the time when the SS people had, they used the local primary school and had sessions there. Quite a number of other schools did that. Accra girls relocated some of their kids from their dormitories and then converted classrooms to dormitories to allow for the social distancing. So then on a case-by-case basis, schools would have to look at their setting, their infrastructure, engage their stakeholders, and try to modify the system to fit the infrastructure and then the various things that they have, and then work with that And I also, Lydia also mentioned that you would have to even relook at the structure of the curriculum. You need to come back. People have been at home for a while. Some people may need a catch-up session. So then the entire system may not just run the same way we've known school to be. We would have to look at both the infrastructural and the structural changes, as well as the curriculum and other things, to be able to meet the kids halfway and implement a very good system. So as I said, we need to look at it on a case-by-case basis, and there should be there are already standing committees that have both health and education together. It's at the national level, the regional level, and the district level. These committees will be engaging the school heads once it happens. It did for the first time, and it will happen again. And as they engage, they'll work with the school heads to have custom-made solutions for the challenges of every school. Thank you.
Right, thank you. Dr. Duval, you've talked about the arrangements you've put in place, and I want to find out, have you considered the fact that if you're having these students, having been away from school all this while, if they're having to come back to school, you would have to, they'll have to readjust essentially to being in a school setting other than they be becoming used to having online or virtual classes?
Yes, certainly considered that. And remember that we will still be running a hybrid system, because we will be still having students online. And I think that, you know, what COVID should have taught everyone is that things cannot remain the same. So I won't comment on other aspects, but we're certainly looking at how it affects us and what it means on education. In terms of students coming back out with our new primary school campus, we had no problems with our primary students returning, because social distancing will not be an issue. But with the primary, the main campus with secondary students, with the hostels, as I mentioned, we need to make sure that we're operating at 50% initially to ensure that, and that will lead me to a question right at the end, Israel. But when students do return, you know, in terms of what I've observed and heard from overseas, that it will take a while and for teachers and students to resettle in. Now, at Tema International School, we've deliberately continued with a full curriculum. As an international school, we've got obligations, so that fortunately with the way that we're organised, that end of semester examinations for our grade 9 and 11 classes at the end of May was not an issue, because we do e-assessments. So nothing was put back, nothing was compromised, and I think there's something for other schools to be able to consider. But in terms of when students do come back, the issue is that students are out of routine. They're probably, I think most of them in some ways have enjoyed having a more relaxed environment. Parents may not have enjoyed that, but getting back into routine, and you know, I still recall the March 16th, when news came out that schools had to close. You would have thought it was the last day of the academic year. And yes, I'd imagine that a lot of schools, a lot of students around Ghana thought, you beauty, that's where we're starting the long summer break. So for some students, they've been out of school for 5 or coming on 6 months. Our students have had the last 2.5 months to vacation. Some have been very actively involved in different online extracurricular activities. So that coming back into a real class situation means settling in routine. You know, we all know as teachers that students coming back from a long break, the typical summer break, takes a while to get back into routine, and that they've been staying up after midnight, they've had their devices on 24/7, etc. So moving back into a more focused learning routine takes a couple of weeks. Now, for students being out a little bit longer, I think we can expect another couple of weeks. You know, from overseas as well, teachers are also noticing that while doing online learning was a complete shift for something that they weren't prepared for, to have students come back in means that they need to readjust tolerance levels and that, keeping in mind that students' routines and actions and that will be out of sync than what they were when they left. So there needs to be understanding from both sides when students come in, so that we can focus on what we really want to achieve.
All right. Now, Dr. Val, you said you had a question, so you can go ahead and ask your question now.
Yeah, certainly. You know, we're very conscious, and I think parents appreciate that, so that even before schools close, we introduced temperature checking to anyone going in or out. If they went in and out 10 times a day, they had their temperature checked 10 times a day, hands washed, etc. And so naturally the protocols will be strictly enforced at Tema International School. There's no question about that at all. We want our students to be safe and well. We want parents to have that confidence. But as we know, there are no guarantees in life except death and taxes. And even COVID hasn't changed those two factors. But I'd like to think that, and I was pleased to hear Dr. Akosua mention that there will be modifications. While she referred to modifications at a school level, if infrastructure did not cater well for COVID-19 protocols, I'm certainly hoping that after 3 months, as we move towards the back end of our first semester, I hope that we may be able to demonstrate, well, not demonstrate, but certainly request that perhaps some of those aspects may be relaxed a bit. You know, I know overseas and that when people were going to restaurants, they had to be 4 meters apart. When numbers went down, that was reduced. In terms, you know, churches are now open, etc. and that. Obviously, for the first couple of months, we need to make sure there is no, if we get confidence, we'll be applying to the health officials so that we may be, while we're only expecting, while we're only going to be allowing 50% of students back on the main campus, I hope gradually we can start increasing that number, you know, for example, up to 60%. And observe for a time to see whether we can go 70%. Keeping in mind that our observations must be able to justify such confidence, and the community knows that, you know, if there is an instance of COVID-19, we'll shut down for 2 weeks. And I know that parents and students and teachers, as we all miss students, a school is not a student. A school is not a school without having students here, and we desperately miss them. We know it's in everyone's interest to be able to observe those protocols, make sure everyone is safe. So the question is, will there be modifications occurring from the health protocol side as we move on after the opening of schools?
All right. I think Dr. Franklin Asiedu-Bekoe is best placed to answer this question. Doc, so Dr. Daval, he's saying that, is there a plan to essentially review the protocols, especially having to do with social distancing in the classroom?
Thank you very much, Israel. Let me say that if you look at the schools, there are categories. We have the kindergarten, they are unique. Then you have the lower primary, the upper primary, the JSS or SHS. So each of these categories has a separate kind of approach to it, because the way the kids in the kindergarten and the lower primary are taught are a bit different. And it's even challenging how you are going to maintain social distancing among such a group. So it brings a very challenging situation about how you can let them start schooling, because basically they are all together playing and said they should observe social distancing. So it's a very challenging situation. When you go to upper primary, then I think that is one area that you can even talk about the use of the face mask or the social distancing. But let me say that for now, the evidence is you need to be apart about a meter to ensure that there's very minimal transmission of the virus from an infected person to you. So far as that evidence has not changed, it will be a bit more difficult to say that you are closing up. Let me also say that the use of the face mask has not been very absolute. So it tells you that clearly the risk of you being infected is still there. But one thing which is very good about COVID is that it's a very novel disease, and things keep on changing. Maybe with new evidence, we will need to now look at a few modifications. But for now, the evidence is that you need to maintain a physical distance of 1 meter apart. And as Akosua was saying, because the class sizes don't have that space, it will be very difficult to maintain the school as it used to be. So now this issue about shift system or staggering all needs to be brought on board. I think that so if you look at some schools, maybe the upper primary can start whilst we still think through the lower primary. Because as I said, if you look at the national data, there's very little infection among the, let's say, under 5, or let's say up to 9 years. But as Akosua said, though they are not actually infected, they actually infect their parents. And this disease keeps on changing. So you cannot be very certain what's going to happen in the next 3 months. So for now, it is not very evident that we are going to narrow down the spacing between students so that we can accommodate numbers. What is very obvious is that we need to now do several classes, or in the sense that you need to have the man hours to achieve your curriculum. So I think the answers are a bit difficult, but let me say that there are standing teams at the national, regional, and district levels between health and education, all to address this challenge situation of fixed spaces with high numbers. So I think that it will be difficult now to say that if we are going to narrow down the spacing between students to get more numbers on board. Thank you.
All right, thank you very much, Dr. Franklin Asiedu-Bekoe. Dr. Charles Sarpong, would you have anything to add to it, and especially the question that came up? Well, that question we can say has been adequately taken care of by Dr. Franklin Asiedu-Bekoe, but if you have any other points you'd want to make.
Thank you, Israel. I think I agree with what both Dr. Asiedu-Bekoe and Dr. Ayisi have said. You know, COVID-19 is a novel disease and things keep changing. So it's very difficult to say you are going to change certain things when you don't know what is going to happen. What has been proven and what is now being used as a protocol, safety measures, we will still have to adhere to them. And then over time, see how things change, how things evolve. And based on that, we can decide on what we want to do, what we can relax, or what we need to enhance more to ensure that everyone is safe. I think the only thing I also want to add on to this is to say that there's not going to be anything like going back to what used to be. that's what people call normal. No, we are now in a new season. And I believe that with time, we'll get used to the new normal as things evolve and as we learn more about the disease and we are better able to handle it and ensure the safety of everyone. I also heard about a contribution by, I think it's Lydia, who talked about, you know, they have a problem with students that are burdened. But then when you have students coming from home, they are coming from different places. You don't know who they have gone to interact with every day, and they come and then they may expose other students or put them also at risk. These are some of the things that I believe the standing teams will have to look at and ensure that we address properly so as to minimize, you know, transmission of infections. Thank you.
All right, Dr. Duval, you want to come back on your question?
Yes, please, Israel. First of all, they mentioned the engagements with schools and that. As far as I can see, there's been little engagement, and I would certainly welcome some of that engagement. At Tema International School, we're fairly, we have a strong focus on setting standards that we're proud of. So our standards are probably a little bit stricter than what the health officials are saying. But I think that what needs to be kept in mind that, you know, one is that schools seem to be the forgotten party in all this. It was safe enough to have crowded public transportation around without people wearing masks that are still evident. People around, adults around at polling stations, etc. So yes, the importance of having role models for students is absolutely critical, because we you know, the sooner COVID-19 drops off the end of the earth, I think we'll all be pleased. But you know, we also need to keep. There was a concern about early years preschoolers and that. I think there needs to be, people need to be reminded that in actual fact, I believe that younger students, including primary students, are actually probably more compliant than older students who in their teenage years think they can, they know everything. I'd also, you know, my question was not about the start of the reopening of schools, which I said we would strictly enforce, and probably at a higher level than what the health officials are wanting, because that's our standard and our requirement to making sure schools are safe. But I would invite the good doctor and other health officials along, particularly to our primary school, to see what we're doing, so that there is an assurance for them that things can happen. Every school is different. Every student is different. I assume most might be parents, so they know with their children that every child is different. So I think we need to look at an individual basis. I know it's very easy, you know, we come up with the factory model of education where one size fits all, but that's an incorrect model in the 21st century. That usually doesn't work. So I invite the doctor to come along and see what can work. You know, we also need to keep in mind that while every school is different, and I think it was St. Paul's that we're talking about 1,000 odd. I know different government schools might have 2,000 kids. You know, we only have 330 in the old normal times on the secondary campus. We have about 50 for the primary school. So we're not talking about large numbers. With small numbers, everything becomes personal, and therefore that sense of ownership is even stronger and responsibility in that. So my offer there is to the health officials that a month after the schools reopen, I hope they can engage with Tema International School so that we may be able to move forward, so that the new normal is also developing perhaps realistic but very safe modifications to hygiene protocols that will continue for years to come.
Right. Thank you, Dr. Duval. Do we have, okay, Lydia.
Yeah, I just want to add something to what Dr. Duval said. We do appreciate the health concerns, but one thing they shouldn't lose sight of are children are excellent change agents. Probably if children had been brought on board, the wearing of the nose masks and all that, because from experience, when children are taught something in school, they go home and they try to get their parents and adults to comply. So maybe they shouldn't just focus on the health aspect, but let's look at how we can use the children as change agents to get the message to the adults who are honestly not being good role models. So that is one point that I just want to bring here. Because whenever we've had activities like global hand washing and all that, children go home and this is feedback from parents. Oh, mommy, this is not how you wash your hands. Let me teach you how you do it. So children are excellent when it comes to making changes. So don't lose sight of that. Thank you.
All right, Dr. Franklin Asiedu-Bekoe, Lydia makes a fantastic point that yes, if we could bring the children on board, they could actually get the parents to reform.
Yes, thank you very much. And I think that we wholly buy into all the suggestions being discussed. And as I said, I think that there's a lot of teamwork going on with the health and education groups. Maybe I think that we may need to tighten it a bit. And as was said earlier by Akosua, we can learn lessons and benchmarks from others to make sure that we can actually get the best situation. It may not be a perfect fix, but it will actually be able to address some of the concerns. But what is an obvious challenge is the space. And then if you want to implement physical distance of 1 meter apart, then it's going to be a challenging situation. So we going back to the normal schooling, for now, it appears difficult. I think the same was said by Dr. Charity Sarpong, that if you want to maintain 1 meter apart and your class size is the building is the same, you cannot do it. But I think that the children will wholly be brought on board, and how best they can actually be incorporated into the new thinking, because we are actually in a new era. Everything is changing, and we will be able to learn lessons from others to get the best. But I keep on saying there's a team made up of the health and education, and they are always talking. I hope that the privates are wholly on board, and then we are all singing the same song. So it's not a different message being preached for the public sector, whilst the private is separate. We want to be sure that we have a holistic approach to this challenging situation in the country. Thank you.
All right. Dr. Charity Sarpong, you heard Dr. Duval talk about the fact that, well, he believes that they have some pretty high standards and they have some things that they may want to share with the health sector, or they believe that there are some great examples. And they're also saying that they haven't quite been engaged. Does Tema fall within your region?
Thank you for that. And I'm so glad to hear they are willing to come on board and, be part of what we are doing. I don't know whether the invitation, didn't get to them, or whether they have not been participating. But about that, I know. I will definitely be talking to the Metropolitan Director to ensure that, in fact, all the private schools are also equally engaged and are part of the regular meetings that we have, because through that we can all learn from one another and see how best we can make the system work peculiar to our area. So yes, this will be corrected, and I'm sure very soon he will be part of the team. Thank you.
All right. Now, Lydia, okay, Lydia, you have your hand up.
Israel, I just want to add that we do appreciate all that is being done, because at the end of the day, it's each and every one of us, our well-being and safety. But most often when these committees are set up, I think the focus is on the public schools. We all know what is going on the public schools, and decisions are made that affect those of us in the private sector. without, taking our operations into whatever concern or whatever. I just want to say this. As we speak now, a lot of private school teachers are not being paid because revenue is not being realized. However, the public schools that are the basis of all these decisions that are being made, their teachers are being paid. So I think the decision making is sometimes skewed. And those of us who are the receiving end, we are not consulted. Because with the protocols, I think the difficulty, and as Brother Paul said, the numbers are high in the public schools and all that, but that doesn't mean every school in the country has that, challenge. So sometimes we should look for a middle road sort of thing, because private schools are being punished when they are, maybe most of them may be able to move ahead and do things right. So that's just feedback for the health professionals. Thank you.
All right, and I want to stay with you. My question to you at this point is, we've been talking about the children and the fact that they're great change agents. With all the conversations that have been going on about reopening and all that, have you engaged them at all to find out from them what they also make or what their views are?
We actually have a survey going out this week. We've surveyed parents twice. We have a survey going out to children this week. But Israel, we will listen to them, but I just want to reinforce the point again. Do you have children and they come home and say, my teacher says? I mean, what the teacher says. So if a child comes to school and the teacher says, you need to put on your mask, there is no way that parents can say, no, you don't have to wear it. So children can be great agents to get this message out there. I have another.
I agree with you perfectly about the children being great change agents. The question I'm asking is, I know you've been engaging the parents, and it's good that you say that now you intend to send a survey out. But a lot of the time, just like you're saying, the private schools tend to be ignored in decision making. Sometimes too, or a lot of the time, we tend to ignore that the children also matter, and we should hear from them as well.
No, certainly, the children, we need to hear from them what they prefer, because at least for the first time, they have been introduced to something new. We need to find out. In fact, we are sitting here talking about reopening. Maybe the children want to stay online. So we need to hear their side. Yeah, I've spoken to some families who are very happy with the routines they have on now. No, not waking up early, not doing things. So some people are actually happy.
And there are also a lot of parents who are not happy that the kids have been home and eating all day, and the parents can't do anything else because they're stuck with the kids.
If there's one positive thing from all of this, I think a new appreciation for the work teachers do in the school community. Yes, I think parents have gained a greater insight as to, it's not just getting them to sit down and do the work or color the sheets. It's a skill, it's an art, it's a craft. So sometimes, when schools are charging and parents are complaining. So I'm very happy that they've had to deal with it. And now a lot of them say, oh, when is school reopening? No, they are your kids. Why do you want them to come back to us? So it is, and for me, it's been a good eye-opener for parents that it is not easy. I've had situations when, I remember when we first went home, a parent called me after 2 days, says, my daughter will not eat. She wants her teacher to feed her. Because as a parent, you are in a hurry to rush off to work and all that. You don't have time. The teachers are here coaxing them, singing, jumping, and doing all that to get them to do the work. Teaching is an art. It's not just, something that you get up and go and do. So like I said, if there's one positive from all of this, it's a greater appreciation for the work teachers and the schools do.
Thank you very much, Lydia. And we do appreciate the work that you're doing. I want to come to you, Uncle Paul. Uncle Paul, you've heard quite a bit of the conversation, and I want to find out from you if there's anything you're picking from the conversation that you'd like to share with us. All right, we do not have Uncle Paul at the moment. So I'll come to you, Ken. the conversation has been, or the engagement, I'm sure, has been mainly with the parents, but have we sought to find out from the children themselves what they make of these, the decision to reopen the school, or whatever plans we're putting in place?
Yeah, certainly. As I mentioned before, a school is not the same without students. So teachers, students and parents are looking forward to schools reopening. Your comment before about parents wishing that schools are open was absolutely spot on. You know, there was a lot of frustrations when emergency learning commenced back in March. It was announced overnight. Teachers were taught to teach in a classroom, not online. You add regular power outages and poor internet connectivity, and these were huge barriers to learning continuity. We also appreciate that online learning doesn't suit every student. It suits some, those digital warriors who imbibe on that. But for some, there's the safety of the school, home distractions, personality type are factors that students have identified as being important and why they should be at school. Many students have commented how they did not realise how much they really missed school, which was absolutely great to hear. You know, the younger students and those students who require support are students who really need to return to school quickly. Lockdown made it very easy for parents to assist the younger students in the early years and lower primary classes. However, this is no longer practical for many parents as they need to restart their own businesses and recoup lost financial opportunities due to the COVID downturn.
All right. Now, I have some contributions coming in on Facebook. So we have Emmanuel Tabi says, we have day SHS students in Form 3 who are about to finish their exams. What special thing did they do to control the spread of COVID-19? Are we aware there is no social distancing in our commercial vehicles? And I'm sure that reemphasizes the point that you're making, Ken, that there has to be, you know, some fine balance. And Lydia also made the point. Then Samuel says, Lydia's point about using children as change agents is a good novelty and transformational thinking. Indeed, children have much to teach as adults too. Thank you, Samuel. And Samuel Richmond this time says, the focus should not be only on public schools. And I think that point has been made by several of the speakers. And Jemima says, good point, Lydia. And there are a number of people who are agreeing with you, Lydia. We have Nyamike saying that my grandchildren aged 4 says he wants to go to the real school. Okay, that's interesting. Yes, they're being at home all this while. They want to go to real school. We have Samuel coming back again saying some private schools have excellent protocol. It's time to engage them. There's no better time than now. And then Nyamike comes back, it's good to bring out the fact that parents cannot appreciate the work of teachers. And Yahya says, involving the children in the protocol, in the process, or as agents of change is very necessary. And Sumara Kings, thank you for the initiative as well. Great insights. Thank you too. And she adds, we're definitely all in this together. So yes, we've heard some of the comments that are coming in. I'd want to come to you, Paul, at this point. Paul, you've heard quite a bit of what's been said so far, and I'd want to hear your thoughts on it, especially because you are quite challenged when it comes to space. All right, Paul, if you can hear me, I want you to unmute your microphone, then we can hear from you. All right, Dr. Akosua Ayisi, so if you'd have any contributions to make at this point or any comments about all that's been said.
Thank you very much, Israel. So I think I agree perfectly with all the previous speakers. First with Lydia, that we need to, one, bring the children on in the fight, get them engaged, get them to understand why we need to wear a face mask, understand why we have to wash our hands, and then use them as change agents to help with the home. I think personally for my kids, the new normal has been good. You now have 5-year-olds being able to do PowerPoint presentations and find their way comfortably on a computer. I don't think that would have thought that the kids would be doing that at the beginning of the year. We didn't see this coming. So it's built other skills amongst the kids. It's unearthed IT skills. It's forced them to research more and engage more in terms of reading on their own, learning, personal learning time. So COVID hasn't been that bad, but then we need to gradually bring them into the new phase. Also, the transition should be smooth. And as Lydia has said, we need to look at all sides, not just the structural issues, emotional issues as well. I think one of your reports on Facebook was asking what we have done in terms of the secondary school people coming home. For the day school system was a very good system for us to test what would happen if the regular schools open, because for the day schools, the kids were going in and out. So most schools were doing the daily screening at the gate, the temperature check, and then the symptom check, where they would find out if you have a cough, a cold, or had recent contacts with people that have been exposed. These are things that schools would need to look at as they reopen and institute within their schools, the daily screening as the kids come in. It's essential to be able to have, you may not pick everything, but it helps you to at least pick high-risk cases or people that might have been exposed, and then you would help them isolate. One key thing we may have to do going forward is help parents understand that if the child is unwell, because you see, COVID may present just like a common cold, or it may present just like malaria. And I know Lydia would bear witness that most parents are used to, once school has started, even if the child is unwell, we pack his medications and say, oh, teacher, can you give these drugs to the child whilst in class? So we need to really enforce the rules and ensure that if a child is unwell, she needs to stay home. This is not the time we would bring back to school for the teachers to support us. So there's a lot more we will need to do, but that the engagement needs to be continuous. It should be done all the time. We need to continually let the parents know that the risk is still present, and therefore we all need to be on our watch.
All right, thank you. So there's a question, and the point you make about the children and having them, or the day students, it's something I like to emphasize on. The question has been asked that why would we say it's okay for the children, some of them day students, be board a trotro and get to school, a trotro where there's no social distancing, and get to school and say that they should social distance. How do we reconcile that? Because it's one of the questions that came up. I don't know if Dr. Charity Sarpong, you'd want to take that.
That is a very good question and a real situation. Because how can you tell them they should social distance when already in the trotro or even in the taxi or whatever, there was no social distancing? But again, these are some of the things we will have to look at as we come out with our policies. So I believe that all this will be discussed effectively. Like Dr. Asiedu-Bekoe said, it's too early to say we are dropping this or bringing this on board. But as we start, and within the next month, 2 months, 3 months, we'll be able to address some of these critical issues to ensure the safety of the people.
All right. Then a question has also come through on Facebook. Nyamike, who's watching, says, for how long is it safe for children aged 3 to 5 years to be in face masks?
fight against private.
All right, we're having a difficulty hearing you, Dr. Sarpong, but if you can hear me, the question is, for how long is it safe for children aged 3 to 5 years to be in face masks? Otherwise, if Dr. Akosua Ayisi, you can take that.
Okay. Thank you very much, Israel. So typically, we don't recommend children less than 2 to wear a face mask. We don't typically recommend that. And then between the ages of 3 to 5, we advocate that at least 2 to 3 hours, and it should, when there's no one around, they can take it off. So then it doesn't need to be a continuous period. Ideally, if they are spaced out, well spaced out, they can take it off, but we don't want the children wearing it for a very prolonged period due to the anatomical, the structural nature of their airways. We don't want children wearing it for a very long period. So usually 2 to 3 hours, and even that in between that interspersed periods, they can take it off.
All right. So indeed, this show is actually about you, the schools. So Ken, Lydia, and Uncle Paul, if you have any questions, please feel free to ask them. I have another question coming through on Facebook. Samuel says, Israel, did you miss my earlier points about what are some of the concrete psychological interventions being planned at the school level to address the children's emotional concerns? So, Dr. Deval, I'd want you to take that. Have you put anything in place to address the emotional concerns of these children?
Yeah, certainly. As a school, we have a brilliant wellbeing counsellor, and being balanced is one of the core features of the school, and balanced is looking at academics in terms of doing the best you can. It means being involved in sport, because we know that exercise is important. It's being involved in cultural activities, because we know the advantage of learning and playing a musical instrument, dancing, singing, etc., and a core feature of IB programs of service. So students need to have that balance. It's not just about academics, and that part's critical. Now, within the wellbeing focus, where we emphasise the importance of ensuring adequate sleep, we also have a peer support buddy team involving students, so that the structure is there. Our wellbeing counsellor and team are available at all times, including when they're online. And the important realisation is that if there is something of concern to a student, that's going to interfere with their learning and their achievement in whatever area it is. So wellbeing is absolutely critical in this, if they're going to be the best person they can. And that's something that we value very strongly at Tema International School.
Right. Lydia, how about you?
So we deal with the bulk of our population. We have a lot of younger kids. And what we have done, in fact, throughout this break, we have maintained a constant, we've kept in touch with our students. Even for the younger ones, the toddlers, on weekends, we arrange Zoom meetings where they get to see their teachers and their classmates. And it's been very emotional for the kids. Sometimes they don't talk at all. In fact, some of them cannot talk, but just seeing each other, it's been emotional, and we have kept in touch. In fact, 2 weeks ago, for instance, for our KG graduation, we did something very special. We had the virtual graduation slated for 4, but then we had graduation boxes, and we had the teachers drive to the homes of about 90% of our pupils just to hand over their gifts. And it was very, emotional for the children and the teachers, but we visited every child in the home. Our teachers are staying in touch with the children, calling them over the phones to see how they are doing. So we have maintained, because we know that that is important. A lot of people focus on the academics, but we tend to dwell on the emotional well-being of the kids, because if kids feel loved, they will learn. If kids know that my teacher cares about me, they'll do whatever in their power to make their teacher happy. So we always, in fact, the first value, our school value is love. So we show the children a lot, and we have maintained that throughout the break. We have kept in touch. We have visited them in their homes. Every now and then we do something to surprise the kids. All right. So we are very much aware of that. Yeah.
I think that the bit about the teachers driving to the school is quite touching, and you must be commended for that. Thank you very much for deciding to do that. The other question I want to ask you, Dr. Ayisi, is, and I'll just ask you now so that you can prepare for it. I want you to tell parents who are watching right now what they should be looking out for by way of symptoms. So when COVID started, we were told that if you're having a runny nose, you're having coughs and all that, that's what you should be looking out for. But what should we be looking out for, or what should parents be looking out for in children, or what should teachers be looking out for in children to get them to want to, as the warning signs? Then there's a question here coming in from Facebook, or well, a comment. Emmanuel says, I disagree with the view that what we have now is new normal. This is the actual normal. COVID-19 rather exposed our abnormal classroom situation we used to have before COVID-19. How on earth could we have over 80 students in class and call it normal? All right, so there may be 80 students in some classes, I understand, but I'm sure in some other schools, they wouldn't have that, and they'll have a lot less or a lot fewer students. Then Benjamin Boache Dakwa says, we need to appreciate that COVID-19 has served as a catalyst for children to enhance their digital skills. It was going to happen, but it has come earlier than expected. And right, so Samuel Zion says, thank you, Israel, for picking up the issue of psychological intervention. So yes, Dr. Akosua Ayisi, what are some of the things parents should be looking out for in their children?
Thank you very much, Israel. So as we've always said, the common symptoms of COVID is the fever, the cough, sore throat, and runny nose. Then some would have the headache and then chills. They feel chilly, they feel a bit cold. Then afterwards, they feel warm again. Then nausea and vomiting. And then recently too, we are having some people coming up with diarrhea, and then tiredness, profound tiredness. Then the classic thing with COVID is the anosmia. So the loss of the sense of taste and smell. I have a family who the first symptom was picked in the child. The child woke up and said, Daddy, I can't smell. And then following that, we tested the child, and then the entire family found out about 3 out of 5 of them were positive for COVID. So these are the common symptoms: fever, chills, headache, vomiting, nausea, diarrhea, loss of appetite, and then loss of the sense of taste and smell. Then there are also the kids that would have no symptom at all. Majority of the cases we've had, at least for Greater Accra, over 80% of the cases never had any of these symptoms, but they were actually positive for COVID. So then you may be positive, but you would have no symptom at all.
All right. And are you able to share with us your stats as far as children are concerned when it comes to COVID-19? How many or what percentage of the children or the patients, COVID patients, tend to be children? Dr. Akosua Ayisi.
Hello, Israel.
Yes.
Am I on air?
Yeah, you are.
Okay. So for Greater Accra, as at today, for the children and so between less than 5 years, the incidence rate in terms of kids less than 5 years has been 1.4%. And then those between 5 to 15 has been 5.9. So and those less than between 16 to 18 has been 3%. So looking at the ranges, with less than 5 is just about 2%, 5 to 15 is 5.9, about 6, and globally under 15 is about 6.6%. Ghana in Accra, we've done about 6%, and then up to 18, we've done 9.5%. So this in terms of the distribution, and then in the various age groups. So then children have not been largely affected in Ghana so far, and those least affected are those less than 5, probably because they are staying home more. So then this has been the distribution for the kids. And in terms of the deaths has been very limited in the children. We've just had about 4 kids dying. But the age range for the kids that have been affected, we've had from as early as 5 weeks to as late as 18. Yeah.
All right. So does that warrant, considering the fact that we have children, not very much affected by this, does that warrant the protocols, or expecting them to comply with the strict protocols? Can the protocols be relaxed for children and the younger ones?
You see, the data we have is because largely most of the kids have been at home. You understand? Staying at home is one of the key preventive measures. So it's possible that the transmission is low because most of them have been at home. So would need to still enforce these protocols as we let them out, and then we monitor the trends of the disease, and that would inform whether we need to relax it a bit. What other countries have done is that they marry the measures with the rate of community transmission. So the lower it goes, then they relax a bit. And once the transmission goes high, they tighten it up again. So then we need to let the data guide us. Whatever we have, the low transmission rates in children, because largely the children have been at home. So then once they are coming out, we need to be strict, but then let the rate of transmission and the incidence amongst the children guide. So the daily cases amongst the children, as we follow over time, would direct whether we need to tighten up or loosen. Some schools reopen elsewhere in other countries, and they had to do temporal close down. So it's always the data that would guide. We can't give absolutes. The data would inform policy, and then the direction we take.
All right. Lydia, you have a question?
Yes, I just want to find out about daycare centers, creches and all that, because most of those kids, from 3 months to about 9 months, parents have to go to work. When they come to school, most of them is just to eat and sleep, So what about, why are they also being kept at home? They are not mobile at all. So why can't they go to school?
I'm sure the Ministry of Education in coming up with the guidelines will look at that aspect. But what we have seen and learned from other countries, because of the lower risk of transmission between children, between 0 to 10, some countries actually started the reopening of the schools with this age group. They started from crèche up to lower primary, and then observed the trends, and then scaled up to the upper primary. So, we are learning lessons with, as of yesterday, about 105 countries have now given dates of reopening schools. So we would definitely nationally and then at the regional level be monitoring what is happening elsewhere to inform and guide the way that we need to go to. But generally, the risk of transmission is lower in the 0 to 10, and it's quite similar in Ghana. So maybe some countries started with that age group and then scaled up going forward. And we are still working out the modalities, and I'm sure that the national committee that the president put together would come up with a clear directive on which way Ghana should go. Yeah.
All right. So Uncle Paul hasn't been you know, he hasn't really been part of the conversation because his internet hasn't been helpful. But Uncle Paul, I would want to give Dr. Deval and Lydia the opportunity to maybe share with you some ideas that could help you and the other public schools that are facing challenges regarding the space, because you don't have enough space. But is there anything that you're picking up from this conversation so far? Uncle Paul. All right, Uncle Paul. So, Dr. Deval, is there anything you'd want to share with?
Can you hear me?
Okay, yes, we can hear you now. Good.
Oh, sorry for this. Pardon me, I didn't hear anything at all. Please, what is going on? Yeah.
Okay.
Sorry.
Okay, so there's been a lot that's been said regarding the ideas that Tema International School and the McCarthy Hill School have put in place. And we've also heard from Dr. Akosua Ayisi. Your main challenge is with space. As a result of this conversation, have you come up with any ways you think that you can better handle or better manage your situation?
For now, if the two bodies come in, but we have to work along with the district director, regional directors, and management to see if a shift might be okay or otherwise. But I would prefer that each of the budgets come in turns. For instance, the second years will come around.
Let's be a little patient with Uncle Paul to see if his connection comes back. All right, it looks like it's not. But Dr. Deval, yeah.
Hello?
Yeah, yes.
Okay, that's okay. So yeah, if the first years will come maybe up to the end of October, and the second years will come from there, from 2nd of November up to the end of maybe 18th of December, that will be okay for me. I can have a space for them. Apart from that, well, we'll have to look at maybe strategizing to see whether we could have a shift system to enable the students have a space to continue with their education. I think that is all.
All right.
Hello?
Do you have an infirmary in the school that can take care of?
Not at all. Not at all.
You don't have an infirmary?
We don't have a sick bay. We don't have a sick bay. Yeah.
Well,
I have a poor infrastructure at my end here, and I can let me use this medium to appeal to benevolent people to come to my aid. I don't have a sick bay. I'm actually lacking a lot of infrastructure over here. Hello.
All right.
Hello.
So, well, your pleas have been heard, and I don't know. You know, Tema International School or McCarthy Hill School may just surprise you with something. You never know. But yes, it will be important that you have if you don't have the infirmary, at least I want to believe that you've been mapped onto a health facility, right?
A very close health facility, please. Yes.
All right.
We have been attached to a health facility here.
All right. So that's great. At least that should work for you. Dr. Franklin Asiedu-Bekoe is back online, and there's some of the questions I'd want to put to him. So, Dr. Franklin Asiedu-Bekoe, the question that has been running is, why would we say there's no social distancing in a trotro, and yet when the kids get to the school, we expect them to social distance? How do you reconcile that, especially knowing that these kids are supposed to learn from what they practice or what they see?
Okay, thank you very much. I think that the risk of infection is dependent on a number of factors. One is the space. Is it a static space? The other issue is ventilation. Then you need to look at whether there's a kind of protection between the two persons involved. So, and then other one is exposure, the time of exposure. So if you look at these factors that I've mentioned, if you are in a moving throttle, most likely that throttle has the windows down. And then as you move, the risk of having the virus being stationary to aid transmission is minimal. Then we're also looking at the time of exposure, because most cases you have maybe sitting in a throttle for about 20 minutes, 30 minutes, and even this time that you are moving, as I said, the windows are down, so they have air being blown in and out. So you don't have the likelihood of the virus being available to infect. So the risk is actually different in both instances. That's why we brought about this. So what is crucial is the risk of transmission is being minimal. It's not absolute, but you try not to create the environment that will facilitate transmission. That's why we're saying that make sure that we have 1 meter apart from each other, because most of the students, they are stuck in the same locality for a period of about 3 hours up to 5 hours. And then as they sneeze and cough, then they are transmitting. But if you sit in a throttle, I think that risk is minimal in that perspective. So that's one reason why we are saying that the risk is much more when you have students being close to each other for a long period of time than as compared to when you are in a throttle. I think one thing that is coming clear for this discussion is the involvement of the private sector. I think that most committees are supposed to get all the key stakeholders on board. So we'll see how best we can actually get the mindset or the innovations going on in these private facilities and the innovations going on so that we can get the best. But let me say that I think Akosua said it very early in the discussion that the prescriptions is somehow going to be based on case-by-case basis. Because if you have a very small space, your prescription may be different from when you have large space and small numbers. So you cannot have, let's say, one-fits-all solution for all facilities. But I think that there's a lot of engagement going on about how best we can get the best. The ultimate is that kids must be able to have a set of deliverables at the end of a period. Is a mode of delivery which is being considered based on the circumstances. So I think these are work being done in progress. And I think Akosua also said that the data that we have in Ghana, which is similar to other countries, is the disease is very minimal in children. The data we have in the country, which is similar to the one in Accra, is that we have very few cases in under 1. And then very few even in up to under 5 years. So the risk of transmission is minimal in the children. But the issue is that is it because they are staying at home? So there's a less exposure. So that's why if you are talking about the prescriptions, the first thing is stay at home. So it's a way of making sure that you are not exposed to the virus. So it is not maybe just by the fact that they are extra immune, but maybe because they are not exposed to the risk of getting the infection. That could be the reason why children are safe. And then I think all along we have had this discussion about using children as change agents. So how best are we going to involve them in the discourse is going to be very crucial. But we are very happy that, you know, when the SHS went to school, there was a big backlash that why are we going to kill the children? So now if after 2 months the desire is get the children on board, then I think that is a progress in our response to COVID. So that's why it's good that we all draw together to get the best. But we are happy that people are saying, now let's go to school. It means that we are on course. Thank you very much.
All right, thank you very much, Dr. Franklin Asiedu-Bekoe. He is the head of disease surveillance at the Ghana Health Service, and he's been quite helpful. I'm giving all of you an opportunity to, just say a few things before we conclude. I'd want to start with you, Lydia. Hello, Lydia. Can you hear me? You'd have to unmute. Okay.
Well, I think when all is said and done, I believe we are all looking at our safety, not just the children. I'm concerned about the safety of my staff as well and my personal safety. But we should dialogue. I think we should open the communication channels, not just focus on a small segment of the population, but we should get a wider range. Let's take it case by case scenario, but this situation of lumping everybody together as one size fits all does not help us in the long run. We all hope and pray that things change for the better. Like we said, I don't think this COVID experience has been all negative. The point has been made already about the IT skills of teachers. There were teachers who didn't know how to do PowerPoint. They have learned it. Kids have learned same like so. There are a lot of positives to be looked at here. But in making decisions, and this goes to the decision-making authorities, try and be very broad and open-minded, and let's not focus on what somebody has done in their country. Let's look at our local scenario and then come up with solutions that fit our local situation. Thank you once again for the opportunity.
Thank you too. Dr. Duval.
Yes, thank you. A couple of things. To my personal perspective, education and health should be the top two priorities in any country, anywhere. What concerns me when we talk about the early years and early primary, these are the foundation years to learning. And at this stage, they appear to be neglected while we worry about exam candidates. I hope people realise that there are some primary students from government schools that have been out of school since February with no online learning or anything. How do they catch up that lost time as a major concern? I am concerned that there is a disconnect within the school sector in Ghana. There needs to be a greater respect and appreciation of the importance and value that private international schools provide to Ghana, and that currently I think is strongly missing. I'm sure, Uncle Paul, that any students from Tema International School are automatically thinking about a Butte service project that could involve your school and probably some other school similar to yours. I think that would be great initiatives on our students' behalf. And finally, I think it's absolutely important from other countries. What disappoints me greatly is that if numbers start going down, a lot of people take things for granted. And, I think health officials have been saying right from the start that this could last 2 or 3 years. We cannot relax on what we're trying to do. We might be able to modify, but we can't relax on the basic protocols. And we need to do what we can to ensure a second wave coming through. And that's a responsibility that all has. And Israel, thank you for the opportunity, and I hope everyone on the panel and all your listeners continue to stay healthy.
Yeah, and thank you very much, Dr. Duval. And I heard what sounded like a gesture that you're contemplating for St. Paul's SHS, and so thank you. Uncle Paul, so, well, your concluding remarks, and you may probably be walking away with some sort of promise from Tema International School. Your concluding remarks. Uncle Paul, if you could unmute, please. Uncle Paul is still faced with the same old challenge. I'll come to you, Dr. Akosua Ayisi.
Thank you very much, Israel. I think just to re-echo a few things we've said, the numbers are coming down, but we are not there yet. And it's important that we continue to adhere to the basic preventive messages, wearing the face mask, observing social distancing, and also washing our hands. And then as we look to the reopening of the schools, let us see our existing systems. I'm sure in the first week that the schools are open, everything will be done right. But as the days go by and there are no cases, then the normal tendency would be to relax. But we cannot relax with COVID around. We need to keep the systems tight. Now more than ever, as we have lower cases, they need to be very stringent so that we do not allow room for significant community transmission to be re-established. So let's continue to enforce. Monitoring and supervision should be top-notch. Our teachers, our headmistresses need to be on the ground every time to make sure that things are done right. And eventually we will get there. The new normal will become normal. So I guess we'll cross this eventually. Thank you so much, other panelists, for having us together.
Thank you, Dr. Akosua Ayisi. All right, so Dr. Franklin Asiedu-Bekoe, you're going to have the final say.
Yes, thank you, Israel, for the opportunity. And I think that as the health sector, we want to appreciate you for your direction. I think that you want the best. And I think I said that whatever we have been able to achieve is a synergy between the media, the general population, and the health system. Because we cannot do it alone. There's no need to be complaining. It's about how much you can do to address the challenges. Hopefully, in the next few days, the airport will be opening. And then we are going to have an influx of people coming in. But there's a system in place to make sure that we don't have people who are positive entering. So if you are entering the country, you are going to come in with a PCR test which says that you are negative, and that test is valid within the last 72 hours. You go into the country, you are going to be tested using the antigen test, and that test, the results will be available within 20 minutes. So within that 20 minutes, you know whether you are going home or you are going to the treatment center or isolation center. I think that we are not just easing just for the sake of easing, but we think that the system must be able to live with the new virus. But we are keeping our eye on the data. So whatever decision we are taking is based on the available data that we have. And we hope that we can get the best situation for Ghana. So thank you very much for the panelists and for all Ghanaians, and thank you very much.
Thank you all too very much for agreeing. Each week when I invite you and you agree to be part of the conversation, I appreciate that. I don't take it for granted at all, because you all have your very busy lives and you have to deal with stuff, and yet you make time to be part of this conversation. I want to say a big thank you to all of you and to everybody who has been watching on Facebook. This show is going to be available on my YouTube page, and the previous shows are also there, Israel Live, so you can get to go and watch once again and benefit from the wisdom of the panelists that I put together each week. You all have a good day and enjoy the rest of your Sunday.